Hi guys. Okay, let me just write it down here. Hi guys. Hi. Let me just write this down. I'm just putting it on somewhere else. Okay. Start live. All right, guys. Hi. Okay, notify. I'm notifying everybody. I'm on several platforms. This is going to be a very interesting and eye-opening conversation that I'm going to have with everybody that's listening. We are talking about endometriosis. We are talking about hysterectomies. We are talking about endometriosis coming back after you had a hysterectomy. Is it possible? And we are talking about endometriosis and surgery, which is going to be number 19 for my only daughter. So I want to welcome everybody that's here, that's watching us. This is going to be a very interesting and not happy occasion for me because I'm the mother of only one daughter, and my daughter has suffered for over 32 years from PCOS, endometriosis, unwanted hair, a weight gain. She was well over 100 pounds overweight. My daughter had 18 surgeries, could never have any children. And 5 years ago, she had the final dissected uterus removed because they tried to preserve it, which didn't work. So she had 4 surgeries until eventually the last part of her uterus came out, and that was 5 years ago. I am presently in Atlanta, in my clinic in Atlanta. So to those of you who don't know me, my name is Eva Taub, and I own a skin and laser clinics in Miami Beach for 40 years and the second one in Atlanta. And I specialize in hormonal imbalances, and I specialize in PCOS, endometriosis, Cushing's disease, a thyroid condition, insulin resistance, all of the above, that is all related to women, and it disproportionately affects Black women and Hispanic women. So endometriosis and Cushing's disease and insulin resistance is something that affects millions and millions of women. And I, as first of all, as a mother, as a human being, I'm talking to everybody today. I'm sharing something that for me personally, as a mother, and anybody that is a mother, you can relate to it, that it must be extremely painful for a mother to an only child, to an only daughter. My daughter went through 80 surgeries. My daughter lost 70% of all her organs because endometriosis stage 4 destroyed her life. And there's so much misconception, so much misinformation out there. And there are so many people that know shit from Shinola. And there are so many people that talk about endometriosis. And guys, they talk about endometriosis, they talk about PCOS, they sell you some shit vitamins and supplements and tell you you will lose weight, you will have children, you will be happy, everything will be okay as long as they can make a buck. And I'm calling all of you out, men and women, and I'm telling you right now, you're full of shit, and I would suggest that you stop doing this and you stop promoting garbage and promoting shit to people, because no man with a penis and testicles knows what endometriosis is. No man in reality knows what it is to have childbirth. No man in reality knows what it is to pass blood clots every month, to have pain when you get your period, to climb the wall. No man knows. So what rights do any man on social media to talk about endometriosis and about women? And what pains me and what upsets me, and this is why I'm sharing my daughters and my personal life with you, because Enough with social media bullshit. Enough with the fact that they are idiots, they are crowned idiots, men out there and women that are size 2, that are blonde, blue eyes, that are tall like langustas, and they talk about PCOS. I had PCOS, I had endometriosis. Bullshit. None of you had PCOS. None of you had endometriosis. No man with a penis has PCOS, endometriosis, and has no business talking about women's health. Everybody is hacking vitamins. Everybody is hacking shit. Everybody wants to get a post and to get money from going public and get people to subscribe. I don't care if you subscribe or don't care. If you I don't care. Subscribe, don't subscribe. It's fine with me. What I care is this, that it is highly on time, that women should know the truth and women should be educated. And there is so little education. There is so little information out there in America and on social media that educates women. And this is something that I am doing since I came to America and since YouTube came into business. And that was 14 years ago, 15 years ago, I started to talk about these subjects. And I started to talk about women that suffer disproportionately from PCOS and endometriosis. And do you know who disproportionately suffers from it in America? A black woman. And in the black population, do you know who disproportionately suffers? Which profession suffers the most from endometriosis, being overweight, having a full beard of hair? Nurses, black nurses. And why is that? Because black nurses in America work so very, very hard. And black nurses usually have families, so they have several children. A lot of them are single. A lot of them work 12-hour shift. A lot of them work day and night, and they put themselves last. They take care of patients. They take care of their children. They come last. And if you think that when a nurse works in a hospital and she has a beard and she's overweight and she's 200 pounds overweight, 150 pounds overweight, then a doctor gives a shit or cares? No, that doctor is there to take care of his patients, to make money. That nurse is invisible to him. That nurse is a tool. And it is so sad. It is so sad to see so many black nurses being inflicted with it. Because, as I said, they have to raise their children. They work very hard. They work 12-hour shifts. They have to make money. They don't have the ability to take care of themselves. They don't have the ability to cook for themselves. So they eat in the hospital. The food, you would think that the hospital would have a best interest at heart to provide healthy, proper nutrition, not sugar-filled shit. But hospitals provide you the worst food that you can imagine. And what is a nurse to do that works so hard? She needs to eat. She prepares 4 lunches and sandwiches to her children. She has time to prepare food for herself? No. So she eats in the cafeteria. She eats garbage. And it's a vicious cycle. And she never has time. How do I know this? I'll tell you how I know it. I have a clinic in Bay Harbor in Miami Beach for 40 years. I've seen thousands of nurses. I opened 9 years ago my location here in Georgia in Noonan. And I see hundreds of nurses that come to see me. I see people of all walk of life. But I see nurses disproportionately. And the reason that I opened my clinic in Georgia is because so many women and so many black women and so many women in the deep south have no voice. Ladies and gentlemen, let me be very, very clear. Let me be very, very clear. 20 years ago, they knew very little about PCOS and about endometriosis. Let me be very, very clear to you. I happen to know a lot about both subjects because my only child was inflicted with it 32 years ago when my daughter was 14 years old. My daughter is a mixture. Her father was dark and I am light. So my daughter is a mixture. My daughter was inflicted first with PCOS, polycystic ovarian syndrome. Anybody that has polycystic ovarian syndrome at age 14 knows how painful it is, how painful your periods are, how blood clots you pass, how unbearable it is, and when a cyst ruptures in you, how painful that is. However, 32 years ago, the answer that I got, and I consider myself educated, I consider myself intelligent, I consider myself worldly. I come from Europe, I traveled, I studied all over the world. I happen to know one or two things about medicine. I happen to know one or two things about hormones. I consider myself to be an educated, intelligent woman, and I am a mother lioness. And I would do anything, I would put the white of my eyes for my daughter. But that's not possible. As a human being, that's not possible. So I did the best that I could, and I inquired. But I can tell you, when my daughter was 16, the answer that was at a hospital in Miami, I went to see a gynecologist that I was recommended to at age 16. He said, listen, the best thing is have a hysterectomy, then she will never have any problem. I picked up my daughter, I said, go fuck yourself. I got up and I left. To tell a mother and a 16-year-old girl, have a hysterectomy. I mean, is that outrageous? Is that stupid? What is it? So this is what we dealt with 32 years ago. And so I fought for my daughter. Obviously, my daughter could never have children. Obviously, she could never have children. My daughter had 18 surgeries, of which 14 surgeries were done in Georgia. And 4 surgeries were done in South Florida. So my daughter successively, slowly, so first it was PCOS, then PCOS evolved into endometriosis, and endometriosis then evolved to endometriosis stage 4. There are different stages. My daughter evolved to endometriosis stage 4. This is a disease. This is the most horrible disease that women have, and the disease is so misunderstood, and so many mistakes and so much bullshit is being shared. So let me just tell you what endometriosis really is, and why today, the 9th of January 2026, sorry. Let me just tell you why my daughter is going in 10 days for surgery number 19. And my daughter doesn't have ovaries, my daughter doesn't have uterus, my daughter doesn't have tubes, my daughter doesn't have any of her organs. Everything was removed. Everything was removed because endometriosis attacked every single organ in her body. Every single organ. And those of you who don't understand what that means, I tell you what that means. If you can picture, you say a Play-Doh, and you take a Play-Doh from point here. If this is your ovary, just let's say this is your ovary. From here to here, and Play-Doh now pulls from this ovary to this ovary, and it pulls. Now, when you get your period, your ovary swells with blood. Your ovary swells on both ends, and the endometriosis already wrapped itself around the ovary. So when you put a string around something, and this is expanding, but it can't expand, so everywhere that there is no string, the blood will push out. The pain is excruciating. And this is what my daughter went through for 32 years. And every time that the pain was unbearable, and ladies and gentlemen, just so you understand, no stupid vitamins, no stupid supplements, no stupid exercise can take this away. You know what took it away? Painkillers, morphine, Percocet. That would alleviate her pain. And when her pain was unbearable, we would go and do surgery. And so I want to share something with you. I want you to understand something. Endometriosis is a disease that has no cure. There is no cure. Some people are fortunate enough that you can have excision of endometriosis, and after maybe 2 or 3 surgeries, you will be fine and you can get pregnant. It just depends which stage of endometriosis you have. The second thing, which 99.9% nobody knows, and no doctor takes the time to explain you because majority of doctors don't know. So let me just explain you. You have 2 kinds of endometriosis. You have endometriosis which lives inside your uterus, inside your womb. That's where endometriosis lives. That's the endometrial lining. I believe that it is a genetic defect. I can't tell you for sure, but I believe there is a genetic defect where the lining inside the uterus is crawling out, and it crawls out like cells. So the lining is crawling out from the uterus, and it's crawling out, and it's crawling out. If this is a uterus, here is your vaginal canal, okay? Uterus, and then you have the vaginal canal. So the endometriosis crawls out from your uterus, and then it crawls into the vaginal canal. And as it crawls, it attaches itself, and it creates adhesions, and it quasi like burrows into the flesh, whether it's your uterus, whether it's your vaginal canal. It just burrows and creates adhesions. These adhesions are extremely painful. The only way to get rid of the pain, and they create hemorrhaging, blood clots, irregular periods, all of it comes together. The only way to get rid of it, is to excise it, get it cut out. Because there's nothing you can do, there's no vitamin that you can take that can get rid of endometriosis when it's growing or attaching itself to different organs. So you have to excise it. Now there is a secondary endometriosis, and that's the one that lives outside of the vaginal canal and lives outside of the uterus. And that's like a parasitic, a cousin of the endometriosis that comes from the lining of your uterus. It's a parasitic endometriosis, and it lives on the outside of the uterus, and it lives outside of the vaginal canal. There was a belief, because so little is known and so little is invested in research for women. So there was a belief that if you do a hysterectomy, and this is why so many Black women in their 30s were told to have a hysterectomy, you will stop with the endometriosis, you will stop with the hemorrhaging, just have a hysterectomy. Because they did not research, and they did not invest the money to research, and particularly if you are coming from low social economic background, it's a numbers game, it's dollars, it's a numbers game. Just yalla, let's just go, let's just do surgery, let's just remove the ovaries, it's money and goodbye. The reality is that you can remove your uterus, you can remove your ovaries, you can remove your tubes, you can remove everything inside your reproductive organs, and you will still have endometriosis. And that is exactly what's happening to my daughter. My daughter, successively over 32 years, she had 18 surgeries. And every time they were cutting, every time they were removing, it was a tube, it was her appendix, it was her uterus, it was her ovary, it was her lower colon, it was her intestines, it was the stomach wall, it was on her diaphragm, it was in the vaginal canal, it went to her urethra, it went to her kidneys. So every time they were cutting it out and cutting, if the organ that it attacked was involved and they couldn't get rid of the organ, then the organ had to be removed. And this is how, over the process of 32 years, she lost 70% of her organs. And she had to have reconstructive surgery on her colon, on her intestines. She had to have a lot of work done so she can function. And 5 years ago, the last part of her uterus came out. And she's a young woman. So as a young woman, she went into early menopause, which is a completely different story. And then she went into an early menopause, and because I know so much about bioidentical hormone replacement therapy, because I am on a bioidentical hormone replacement therapy myself for over 20 years, so I said, okay, my daughter needed immediately, after she had the full hysterectomy, and now she lost estrogen, progesterone, and the only dominant hormone was testosterone, we needed to get her on a bioidentical hormone replacement therapy. The reason I share this with you, because it is so important that it's not enough that you have the knowledge, that you have they know how to do. You also have to have amazing doctors. And sometimes a doctor can kill you, and the wrong doctor can destroy you. And I am going to tell you that when she had her hysterectomy, I'm not going to say who the doctor was. He has to talk to God when he meets God. He has to talk to God because he created him. He was recommended, and I went to see him, and he was a gyno-endocrinologist, so you couldn't get any better, except that he was making experiments, and he made experiments without telling me, and he used my daughter like a rabbit for experiments. And he used, after my daughter had hysterectomy, he put my daughter on mega doses of testosterone, because he said, oh, she's losing progesterone, estrogen, we will balance it. And then he put her on estrogen patches. And he insisted that my daughter needed to go on heavy doses of testosterone. Ladies and gentlemen, have you ever heard a 40-year young woman have stage 3 cataracts of both her eyes and going blind? I'm sure you didn't, but that's exactly what happened to my daughter, because he screwed her up so badly by pushing and stating that she needed to go on heavy testosterone, and he raised the testosterone and he raised the estrogen, because he said when you lose everything you need to bring it back up. She's 40 years young, she's young, so he pushed everything, and my daughter protested, and she said, well, but I am getting hairy. I mean, my mother did laser on me for years and I got rid of the hair, and now I look like a bear again. And he said, don't worry about the hair, your mother can do laser on you, but we need to do this. And then one day she called me and she said, Mom, I can't see. I said, what do you mean you can't see? She said, I see everything with a shadow. I cannot see. And I said, well, what do you mean? She said, I can't see, I can't drive, and particularly at night. So I took her to Bascom Palmer Institute, which is the #1 eye institute in the world, I think. It's in Miami. And before I took her to my eye doctor. And he said, Eva, she has very heavy cataracts on her eyes. We need to remove it, but we'll do one eye and then we'll do the other eye. I said, fine. And a day before surgery, he called me and said, I cannot touch her. I said, why? He said, her case is so complicated. When I analyzed behind her eye, he said, I have never in my life, in practice 45 years, seen a 40-year young woman with that complicated heavy cataracts. He said she only has to be operated in the hands of the best eye surgeons at Bascom Palmer Institute of Miami. And so he personally made a phone call, because it's a waiting time for a year or 2 years before you get in. And they accepted my daughter within, I don't know, a month. They accepted my daughter, but because it was very fast, and because a 40-year young woman does not have cataracts, and heavy cataracts, so insurance wouldn't pay. So we had to pay $15,000 cash for the hospital, for Bascom Palmer to accept her, because insurance wouldn't pay. And I didn't give, at that moment, I didn't care about anything. I didn't want my daughter to lose her eyesight. And so they operated on one eye. It was a very complicated surgery. They had 2 specialists operating on her for 2.5 hours, because it was a very complicated situation. And the conversation then started, and they said, well, we cannot figure out, how is it that a 40-year young woman has such a heavy cataracts that 90-year-old people don't get? And then we went over the history, and bingo, the testosterone that the doctor that forced my daughter and insisted that she should go because she had a hysterectomy and because her hormones are so down, he pushed her up. The overdoses of the testosterone and the estrogen and the progesterone destroyed my daughter's eyes. So she had surgery, and 2 weeks later they did the second eye, and thank God they put implants in her eyes so she can see. but it was the hormones from the hysterectomy that was done that were given to her by a charlatan, by a guy that experimented on my child because he felt that this is the right approach. He didn't have any data. He just felt. But I was recommended to him. So I thought, okay, I'm speaking to the best guy, the best doctor, because he was recommended. He's a gynecologist. And so he's a gynecologist and endocrinologist. How can it be better? Well, it cannot be better. It was the worst thing that happened to her because she became hairy. She gained so much weight back, and she lost her eyesight, and she continued with terrible pain. So every woman that has endometriosis, every woman that had surgery with endometriosis, you know how painful it is to have sex. Because when you have in the vaginal canal, you have adhesions, and the doctor has to go in and cut out the adhesions and cut out the endometriosis that is like a parasite. It attaches itself to the wall, and then they have to cut it out, excise it, burn it out. That all creates scar tissue, and that scar tissue hurts. And so when you have so much scar tissue, having sex is not the most pleasant thing. And this is something that I want to share, and I want to say this publicly to every man that listens, to every woman that listens, to every mother that listens, to every human being that listens. Don't poo-poo it. And women should not feel embarrassed, and women should not cry in silence because sex is so very, very painful. What I can tell you as a mother, as a professional, as somebody who owns clinics and treats women with hormonal imbalances, there are other ways. There are ways to help you to have less pain when you have intercourse. There are things, and I made videos about this and I talked about this, but I leave this for another time. This is not for now, but I am just putting it outside, and you can go to my YouTube channel, and which is Eva Taub Skincare, and there are a lot of videos that I made about the subject, and I talked with my daughter about it, and I gave information what women can take, what women can do to help themselves to have less pain, less dryness, less irritation when they have intercourse, when they had endometriosis removed, and they had several surgeries. Now going back, so now you know that my daughter was mistreated, my daughter was given the wrong medication, my daughter had 18 surgeries, lost her 70% of her organs, was then, after she had the last part of hysterectomy, was then pushed into the hands of a charlatan, because I have no other words. For a guy that will experiment on a young woman for the sake of him to write a dissertation or to make experiments is unacceptable. He should have asked me, asked my daughter, do you want to participate? Do you want to be an experimental rabbit before he did what he did? But you know, water over it, because it already happened. The reason I share this with you is because I want to open your eyes, because I want to tell you, woman, you are responsible for your own health. Just because somebody has MD in front of them or behind them does not mean that they are knowledgeable. There are very few people that are knowledgeable in the field of PCOS and endometriosis. A lot of bullshitters, a lot of people come up on social media. PCOS and endometriosis, I think, became a fancy word. So a lot of bullshitters come up, and I hate every one of them. And I am calling every man that talks about endometriosis, every woman that talks about endometriosis, they know nothing. You all will have to pay the price one day, because he up there sees everything. And you will have to price. There is karma, and karma is a bitch. And karma remembers what you do. Because if you do it for fucking few dollars, and you give the wrong information to women, and you are pulling women, and you are telling women the wrong thing, because you want to sell some stupid vitamins, because you want to get some clicks, that's a crime. That's a crime. The right thing to do is step away, talk about something else. Do not mislead women. Women suffer already enough. Women that have PCOS, women that have unwanted hair, women that suffer from Cushing's disease, that suffer from insulin resistance, that are overweight, that have facial hair, that have hair on their chest, that have hair on their breast, that have hair from the umbilical cord going down. Women suffer enough. There is no reason in this world whatsoever that people should give information to women that are wrong and mislead women. I do not accept it. I am sorry. I think it's a crime. And so what I'm sharing with you today, and guys, I'm talking with passion, I'm talking with anger. I'm talking with anger because I see so much going on social media and so many lies that are going on social media and so much bullshit that's going on. And I see people have 1 million viewers, a fat guy like a potato couch. He's talking about endometriosis. And he has nearly 1 million women that are subscribed and they're hanging on every word. And what is the end? He's taking information from people and then he's hacking vitamins. Vitamins will not help you with endometriosis. Vitamins will not help you with PCOS. Vitamins will not help you with Cushing's disease. Vitamins will not help you with insulin resistance. You have to take yourself into your hands. You have to do research. You have to research. You have to educate yourself. You don't take some fat job that is explaining you and selling you bullshit because you will go nowhere. Now, here's what I'm going to tell you. On the 22nd of this month, I am bringing, so I'm in Georgia, I'm leaving Sunday, I'm treating patients here and clients, and I'm going back Sunday to Miami. And then following Sunday, we are coming back to Georgia. Because there's only one expert. Hi, Sarko, hi. There's only one expert in America that specializes in excision of endometriosis. And he's in Atlanta. He's the #1 endometriosis excision specialist in the world. In the world. I met him 20 years ago. I researched and I found him 20 years ago. He operated on my daughter 14 times. 14 times in a period of 20 years. He's the most amazing human being. He's a very, very religious man. Very religious. He prays every time. Every time he goes into the operating theater. It's something you don't see today. And I would sit with my daughter. And this is also something that I want to share with you. And I want to give a shout out to Northside Hospital in Atlanta. Because hospitals in Miami are shit. One is bigger shit than the other one. But I will tell you this, Northside Hospital in Atlanta is an amazing hospital. And the last time I was there was 5 years ago. And I wrote a letter because usually people write letters to complain. And I wrote a letter to the CEO and I said, listen, whatever you are doing and whatever you are doing with your nurses, whatever you are doing with your pharmacists, whatever you are doing with your staff, they're amazing. And I have so much experience and I asked the nurses, I said, did you go to a special school? And they said, no. And I said, so how are you so warm? How are you so kind? How are you so caring? So she said, first of all, we love our job. Secondly, Northside Hospital takes very good care of us. And I will tell you, this makes a huge difference. And so my daughter used to get out of the 14 surgeries, half of them were done in Dunwood. It's another smaller hospital. Everybody is very, very warm. And if you think like, okay, Eva, why are you talking about Northside Hospital? Because I have been in Miami. I have been in Cleveland Clinic. And if you put a bullet to my head, I would never go back to Cleveland Clinic, the biggest shit in the world. The biggest shit in the world. It's a money-making factory. You're a number. And Miami, Aventura Hospital, Mount Sinai Hospital, shit bigger, one is bigger shit than the other one. You come to the emergency room, and this already happened. My daughter was in agony. We rushed her to the emergency room. It's freezing in the emergency room. You ask for a sheet or for a blanket because a patient is going, so we don't have any. They bring you eventually after 5 hours into the emergency room, and then you wait another 2 hours for somebody dare to ask for a warm blanket, dare to ask to be covered. In the best case, they throw it in your face, and then they tell you we don't have. It's very different. Northside Hospital, Dunwoody Hospital, blankets, heat, Mylar cover up. It is just so very different. It's just so very different. The experience is so very different. And so, no, I'm not looking to have my daughter cut up open, and they're going to cut her open from under her breast all the way down, because they're going to explore where the pain is coming and where did the endometriosis, the secondary endometriosis, go in her body. We already did CT scan. We found out there's something on her kidneys, but we want to see more because she's in agony. She's in pain every single day, and I know what it is. I know it's endometriosis. So even if she doesn't have a uterus, if she doesn't have any reproductive organs, she doesn't menstruate, she still has endometriosis, because we have two kinds. The one that comes from the uterus and the one that lives outside of the uterus. And that one can live with you for the rest of your life, and there's nothing you can do short of cutting it out and getting rid of it. And this is exactly what we are going to do now in 10 days. So we are coming. So I'm going back Sunday, I'm driving back to Miami, and then we are driving back on the following Sunday back to Georgia, because she has to do a pre-op. So we are doing this, and then she will go into surgery at Northside Hospital with her surgeon. And this is a surgery that we don't know what the outcome will be. But I have to weigh her being on heavy medication every single day of her life, which she was for the better part of her life. And we hope that after everything came out and the final hysterectomy was done, that it will be done. But God had other plans for her. Or do exploratory surgery and go and find out where endometriosis is. And just for those of you who don't understand how this process works, they actually make 3 incisions in your abdominal cavity, and they push through the vagina, they put gas in, and they really blow you up. And then they put a camera in, and then they go, and if necessary, they open wider, and they go in. And with a camera, they look and they flip you around. You're out, and they flip you around. Your organs, whatever you have left, is floating. And so they can go around every single organ. And they are going to the diaphragm, up to the diaphragm. They're going to go to the lungs. They're going to check. Because this is, again, nobody understands. Endometriosis can go to your lungs. Endometriosis can go to your heart, and endometriosis can go to your brain. Nobody knows this. Nobody talks about it. But endometriosis can attack your kidneys. Endometriosis can attack your bladder. Endometriosis can attack your urethra. Endometriosis can attack anything. And there was talk. I heard doctors, because I have a lot of doctors who are so they are patients, clients of mine, and so they are friends of mine. And there was conversation between doctors, and we talk about this. Why is endometriosis not considered and put in the category of cancer? Well, we know why, but the reality is that it is equivalent to cancer, what we consider cancer, with one difference. There is no cure for endometriosis. There is nothing, there's no damn vitamins and supplements and exercise that will take care of endometriosis. Doesn't exist. And the only thing that you can do is cut out, excise. Organ that's attacked, you excise it. You remove endometriosis, you remove the organs. This is how she lost 70% of her organs. This is why my daughter, colon had to be reconstructed. This is why she had to get stem cell stems in her kidneys. This is why she lost her uterus, she lost her appendix, she lost her gallbladder. She lost so many organs in her body that were destroyed by endometriosis. They were just attacking, wrapping itself around, and the pain was just excruciating. So this process is a process. There is no cure. There's not a tablet, there's not an injection, there's not a biologic that you can give to somebody and say, okay, we will finish with endometriosis. And ladies and gentlemen, let me just tell you, when you analyze, there is more in medicine. So much we know about medicine, but the more you know about medicine, you realize how little you know about medicine, because the more we know, we realize how little we know. And when you say, Eva, how is that possible? Okay. Hi, everybody, guys. Karen, how are you? Hi. Hi, hi, hi. I'm sorry, I'm not looking because I have several telephones and I'm talking in several cameras, so I'm not responding. I apologize because then the train of thought. But when I'm finished talking, I will look and I will answer your questions. P.S. Guys, and this is not a pitching a selling job. I have a link. So I have a stand store, stand like Stanley, stand store. So I have it on my homepage, and I have information there. And there's some information that's actually for free that you can download that I put in there. So it's in one place. So you can go to look at my homepage wherever it is, and there's a link to Stand Store. So to those of you who either go off later or earlier before I finish, because I can talk forever, but I talk with passion, I talk with care, I talk with love, I talk with anger, I talk with emotion, because I have all these emotions in one, because it's enough. Because for 32 years, when you suffer with your only child, and when you see your only child go through pain over and over and over, and she looks in your eye and she says, Mom, since age 14, I haven't had a day in my life that I didn't have pain. That's hard. That's hard to hear. And you learn to live with pain. But when pain becomes so excruciating, you don't want to live with pain. You want to get rid of the pain. So you do everything, and I believe you have painkillers. If you have pain, then pain has to be addressed. But it takes a toll on you, because when you take so many pain medications, they take a toll on your psyche, they take on your depression, they take a toll on you. So living in pain is not alive. But women like my daughter that have stage 4 endometriosis have no choice. They live in pain, and then to alleviate the pain, they go for surgery. And this is why my daughter is going now for surgery number 19. 19, ladies and gentlemen. This is not a joke. Number 19. This is not a joke. And we are going for the surgery because we don't know. From the CT scan, they couldn't see. They saw she has something on her right kidney. They saw this. But they cannot see, because endometriosis, and particularly endometriosis that lives outside of your uterus, that lives outside of your vaginal canal, that endometriosis is like a parasite, and it can go and it burrows into your flesh, your abdominal cavity, around your intestines, any organs it finds. It's like a tick. It will burrow inside, and sometimes it will stay there and it will hide. It will live there, it will hide. A doctor goes in, he checks everything, he doesn't see anything. Her doctor in Atlanta, as I said, is today the #1 excision surgeon in the world for endometriosis. And so I'm very fortunate with the misfortune that my daughter has and the pain that my daughter has. But I'm very fortunate to have him take on my daughter and do surgery number 15 on her, and explore and go and look what is causing so much pain in spite of the fact that she doesn't have regular endometriosis. She has the parasitic endometriosis that lives there, that doesn't need menstruation, that doesn't need blood, that doesn't need any of it. And this is what medicine doesn't know. This is what 90% of doctors don't know. That endometriosis, the secondary endometriosis that can live in your body forever, doesn't need blood. The misconception that you need to menstruate in order for endometriosis to live, that's misinformation. Endometriosis, secondary endometriosis that lives inside the cavity of your body, does not need blood. Do you know what it lives off? Your bodily fluids. Your bodily fluids. We have all water, bodily fluids. It's just a parasite. It just attaches itself, let's say, to your abdominal wall. Let's say to your kidney. Let's say to your urethra. Let's say to your intestine. It attaches itself. And now it burrows. And it creates, by itself, it creates little blood vessels. little blood vessels, just from fluids. And then it supplies its own existence through its own creation of blood vessels, and that's why I call it a parasite, because it is sucking out, it attaches itself like a parasite to any part of your body, of your organs, and then it creates its own environment, and it creates its own blood vessels as a parasite, and it lives out of there, it sucks out of there and then multiplies. So it doesn't need you to bleed. It doesn't need you to have a uterus. It doesn't need you to have menstruation. It will live, and it will live by itself, and it will create an environment, and it will multiply because it's a parasite, and it's worse than cancer, because for cancer at least maybe you can do chemotherapy, maybe you can excise, maybe you can get rid of it. There is no cure for endometriosis. And endometriosis stage 4, there is no cure. And the only cure there is surgery, and that's not a cure, they're just alleviating the pain, excising and removing an organ, removing part of an organ, and removing the endometriosis. And again, I will tell you, endometriosis can kill you. And when anybody tells you bullshit vitamins, that they sell you shit vitamins, that they sell you garbage, it is a crime. It is a crime, because endometriosis is not a joke. And I am telling you categorically, you have endometriosis, it's not only in your reproductive organ. Endometriosis can go up into your lungs, can go up to your heart, and can go up to your blood, to your arteries, and go up to your brain. And when endometriosis encapsulates your brain, you are dead. If endometriosis encapsulates your lungs, you are dead. You cannot breathe. But nobody shares with you. This is not being shared. All that you see on social media is garbage, is bullshit, is men fed like my ass that are promoting vitamins and supplements, and they are stealing information from people, bits and pieces. They know nothing about endometriosis. And women that are tall, blonde, size 2 with blue eyes, and they say, I have PCOS, I have endometriosis. You have bullshit. You are a ruthless bitch that talks because you want people to subscribe, because you want to make money, not because you care about human being, and not because you care about humankind and about women. That's the reality. That's the truth of it. And today, endometriosis is a fashionable word. It's like Chanel, like Louis Vuitton. We are talking endometriosis. Every shit talks about endometriosis. And yes, I am angry. And yes, I am upset. Yes, I'm upset for my only child. Yes, I'm upset that my daughter suffered for 32 years. Yes, I am upset that for 30 or 29 years, I had to inject her every month with morphine. Yes, I am upset that she could never have any children. Yes, I am upset that she had 18 surgeries. Yes, I am upset that she lies on the floor very often when we talk, we do videos together, because she says, Mom, if I lie on the floor and I'm straight, I have less pain, it's less pulling. Do you understand that as a mother, you suffer for your child? It hurts for your child. And then when I see social media and I see all this bullshit that's being promoted on social media, it infuriates me. It infuriates me. It makes me angry, and it makes me really, really upset. So all I am sharing with you guys, this is a very personal story. But I'm sharing it because I know there are thousands and hundreds of thousands of women that have endometriosis, that have PCOS, that have irregular periods, that are overweight, that cannot lose weight, that have excessive facial hair, that have hair in their body, and they have no answer. And they don't know. And they don't know where they should go, who they should go to, what help they should do. They don't know where to go. So all I'm saying is, if this resonates with anybody that I'm talking to, anybody that I'm sharing this information with, I don't care if you subscribe. I don't care if you say, I don't care. I am not doing it for money. I don't care. Guys, I am independent. I am a business person. I am too old. I'm 70 years young. I am too old to care, to give a shit about anybody, about anything. I don't care about social media. I don't care to make money from social media. This is not why I'm here. I'm not selling you anything. I'm not hacking you anything. All I'm giving you is information. All I am giving you is hardcore, true information, true pain, true suffering. Because there are so many women that suffer in silence, that suffer like my daughter in silence, and they don't know where to go. And as I said when I started this, disproportionately, Black women are affected with endometriosis and PCOS and insulin resistance and Cushing's disease disproportionately to white women. White women suffer from it too. My daughter is a mixture. She's white. But my daughter suffers more than anybody else. So it's not necessarily the color of her skin. It's genetics. It's genetics that play a role. But what I'm saying is that disproportionately, I have a clinic in Miami Beach in Bay Harbor for 40 years. My clinic here in Georgia, where I am in Noonan, I have for 9 years. And disproportionately, I see Black women that come to see me. They come to see me for laser hair removal. They come to see me, to cry to me, to talk to me, to ask for advice, to talk to me about discoloration, to talk to me about their weight. They want help. And there is very little, and in particular, the deeper south you go. So maybe when you're in a cosmopolitan city like Miami, or like New York, or like Los Angeles, you have more chances to find some specialist that can help you and know a little bit more today than was known 20 years ago. But when you live in the deep south of America, there is very little knowledge, there is very little care, there is very little understanding. And disproportionately, Black women suffer in the deep south, I would say 3 to 1, 3 Black women on every white woman that suffer from PCOS, endometriosis, Cushing's disease, insulin resistance, and unwanted hair, which is a consequence of hormonal imbalance because you have insulin resistance. Because what is PCOS? What is endometriosis? It's all related to your hormones. So it's all related to thyroid, related to diabetes, related to insulin. It's all related. It's all going together. But there's very little that is known in rural America. And so the reason that I came, and I didn't go to downtown proper Atlanta, and I went to a rural area. I am half an hour south of the airport of Atlanta. And the reason I chose this location, because I am closer to Alabama, I'm closer to Tennessee, I'm closer to Mississippi, I'm closer to Tallahassee. And where I am in Noonan, there is a lot of Hispanic women, there's a lot of Black women. And all this area around, the radius of 200 miles around, you have a lot of Hispanic, you have a lot of Black women, and they have no voice. And the medical care, the more rural you go in America, the less knowledgeable medical care you have in America. And I analyzed this, and I can tell you categorically, it has nothing to do with race. So it's not racist that you don't have good medical care. There's something very simple in the equation what happens. So when you think about it, you have a doctor, a student that goes to school, 8 years, 10 years, 11 years in America. He graduates, he has $1 million in loans, because it costs a lot of money to go to medical school. Now you graduate. Now you need a job. Why? Because you need to start paying off your debts, and you need to eat. You need to pay for your rent. You need to get a car. You need a job. Now, there are only 6 or 7 big cities in America that have big hospitals. And every hospital has only so many places for X amount of doctors. And doctors don't die every day. So there is not 2,000 places in Atlanta, Miami, New York, and Los Angeles. Doesn't exist. If you get 150 openings, that's a lot. But you have thousands of people who graduate school, and all these people need a job. All these people graduated school, now they need a job. So what happens? So a lot of students that graduate, become doctors, get the title MD, need to take a job. And you will take a job anywhere because you can't get into the big cities and make bigger money. So you go to rural areas, you go to hospitals, and you go to small hospitals. And ladies and gentlemen, I speak from knowledge and experience. I'm not speaking out of my sleeve. I'm speaking from facts because I treat here in Nunnan physicians the same way I treat doctors and physicians in Miami. I treat doctors and physicians here. And I actually have 2 physicians here who were students, who graduated, who came and who are working here, around here, in rural hospitals, where they cannot even, small hospitals, that I have a client whose 9-year-old boy fell down in school, broke his wrist, his hand, and the elbow. They couldn't set it. They had to take him to Atlanta because these small hospitals don't have the doctors, don't have the ability. What do they have? They have students who graduated. They have students who graduated, hold on. They have students who graduated school and now they put them to work in these rural places. But they're not experts in PCOS. They're not experts in endometriosis. They're not experts in diabetes. They're not experts in Cushing's disease or Hashimoto disease. They are people who studied and now they need a job. So the care that you would get, if you go to a doctor, they poo-poo you. If you're a Spanish woman, you're a Latin woman, you're a Mexican woman, you have PCOS, you go to the hospital, you have hemorrhaging, they said, okay, just take this and you will be fine. Why? Because that doctor himself or herself doesn't know nothing. They know nothing because how much are you studying in school? When you take a general medicine, how much are you studying? And when you graduate, like how much do you really know? You know, studying in school does not mean that you are knowledgeable. Studying in school, everything is a business. So like you go to school, to university in America, you graduate. When you graduate, you spend $1 million, $500,000, $750,000 for your diploma. You graduate. Half of what you studied has no relevance to what you really need in your life as a doctor. Has no relevance whatsoever, because it's a money maker. Because, for instance, when you go and study overseas in Latin America, you can go and you can become a doctor after 4 years. That's the normal. That's in Europe too. You can become a general GP after 4 years. You finish high school and you go to university and you study to be a doctor. And you graduate. That's the correct way. But in America, no, you have to go to AA, you have to go to pre-college, the college, the bullshit. So you waste 4 years before anything. Then you go and then you take 6 years. And in these 6 years, whatever you learn 50% of what you learn is totally useless. And 50% of what you learn is generally okay, except that in the generalities, you don't learn specifics. You don't learn about PCOS, you don't learn about endometriosis. You're learning from everything a little bit. And you don't learn curriculum about black skin. You don't know the difference between black or white skin, short of seeing it, but you don't know how to treat it. You don't know so much about the unwanted hair, and you don't know about the statistics of black women to white women, because that's not taught in America. That's not taught in America. It's just that's reality. So when I'm saying that there is no real medical care and it's very rare, and this is why I'm talking, this is why I'm sharing, whether you're a Hispanic woman or you're a black woman, you disproportionately suffer more than a white woman. You disproportionately will find less good advice and less good help and less good doctors, because disproportionately you are in disadvantage, because most of the time you will live in rural areas, and even if you don't live in rural areas, you will not necessarily have access or know where to go because you have a XYZ condition. And so because I understand this, because first of all, because of my only child, that had 18 surgeries, lost 70% of her organs, suffered from age 14, from PCOS and got stage 4 endometriosis, lost eyesight because the endometriosis and the treatment of the scrupulous doctor that treated her with excessive testosterone destroyed her eyesight at age 40. You know, I happen to know. I speak from experience. I speak from knowledge. And this is why I'm sharing knowledge with you. But I can tell you categorically, I have physicians that come for laser removal. They are all black because I specialize in Hispanic and black skin. And they know nothing. They know nothing about anatomy of hair. They know nothing really about how it works. They know nothing how laser works, what happens, and they for sure know nothing about endometriosis, cushions, and PCOS, and particularly in black women, even though they are black women. Why they know nothing? Because they are not taught in school. And when you say, oh, Eva, that's not possible, it's very possible, because I will ask you this. I will ask you this. If that is true, and if they teach you, so why is it that dermatology, for instance, dermatology and education about black skin in a medical school has a curriculum of maximum 3 months, and maybe 6 lessons. That's all. Why is there no curriculum for black skin at medical school? For a very simple reason. Because only 15% of the population of America is black. So to rewrite the whole curriculum, it's not necessary, it's not worth it, it's not needed. So this is why when doctors graduate, they know nothing how to treat black skin. It is people like myself who do this over 40 years, who understand, who made it their life job to study, to educate, to research, to go down to the nitty-gritty. It is people like me who provide the information to you, who educate you, who educate doctors, who educate physicians, and say, okay, ABC, this is why it is. And this is why I came to Georgia. And this is why I opened my location in Georgia 9 years ago. It was purely work of love. 2 things played a role. One, that I had an affinity to Atlanta. Because the doctor who operated on my daughter 14 times, and in 10 days will be operating on her the 15 times, totally 19 times. That doctor is in Dunwoody in Atlanta. And he's the #1 expert in the world for excision of endometriosis. And every time I came to see him, I felt, even though he opened my daughter up, even though he operated on my daughter, but he couldn't change the outcome. He couldn't make her have children. He couldn't change the outcome. That was impossible. But he made her life a little bit better, because if it was for a year, if for a half a year, for 2 years, it just depends. He made her life less painful. We could let go of morphine. We could let go of painkillers. If it was only for 6 months, and you say, Eva, why 6 months? I'll tell you why. Because sometimes, and this is what I'm explaining, this is what makes me so angry, why so many bullshitters talk about endometriosis and they know shit, they know nothing. But I can give you a black and white example. I came to Atlanta, he operated on my daughter, he removed all the endometriosis, he removed the tube, he removed an ovary, and he said, okay, Eva, I got everything that I could see. I said, fine. We went home, she was fine, and 5 months later, my daughter was climbing the wall, and she said, Mom, I'm dying. I am in so much pain. I'm in so much pain. I called back, and I said, listen, she's in agony. She's in agony, she's in pain. And he said, Eva, but it's only 5 months. I was inside her 5 months ago. I cleaned everything. So I said, but she's in agony. We have to do something. Oh, he said, okay, get on the first plane. Come here. I will go in. He operated on her. And when he came out, he said, Eva, I have no words. I said, why? He said, in the Guinness Book of Record, it didn't exist, that I excised everything. I removed the organs that were affected. I cleaned. I burned off all the endometriosis in her abdominal cavity. And within 5 months, one endometriosis that is borrowed, and this is what I'm explaining you guys, that there is internal, the endometriosis, which is living inside, and that's the normal, the lining of your womb, of your uterus. But then there is the parasitic endometriosis, which lives outside of your uterus and outside of your vaginal canal. And they burrow into the flesh, so you can't see it. It's a parasite. And that endometriosis, in 5 months, they grew to an extent, and it went and it wrapped itself around her appendix. It wrapped itself around the appendix, and it hurt so much, and it was squeezing because it's like rope, and the rope is getting tighter and tighter and tighter, and it squeezed the appendix, and the pain was so excruciating. So when we came to Atlanta 5 months before he operated on her, he was in there, and I waited outside of the operating theater. And then when he came out, he said, Eva, I've never seen this. He said, I removed the appendix. He said, the endometriosis, he said, I didn't see anything. I understand why. Because you can't see what's inside your flesh, what parasite is hiding inside your flesh. And that's what the endometriosis is, that lives outside your uterus, is a parasite. And so it attacked her in 5 months. And in 5 months, it destroyed it. And he said, if you didn't come and you didn't insist, he said her appendix would have ruptured in half, because endometriosis was wrapping around. So when I tell you, ladies and gentlemen, these are stories that no influencer, no fat job guy that sells vitamins, and there's 1 million people, that have 1 million women that are subscribed to him because he's selling bullshit and he's selling lies, or some size 2 blonde girl with blue eyes. None of these people can tell you the truth. None of these people have you best interest at heart. I don't know any of you, or I don't know most of you. I know some people that come, like I'm on YouTube, and some of my clients that say, hi, Eva, they are here. Or some people that watch me, because I do this for years. I talk, I share, but I don't know any of you. And all I am saying is that I know that what I am saying today is going to help 5 people, 10 people, 100 people, whatever it is, it is going to help people. And I don't want you to buy anything from me. I don't want you to come and see me. I don't care if you subscribe or don't subscribe. I don't care. It's not important to me. I am asking you for one thing, and only one thing, because I really don't know how social media works. I know on YouTube this will stay, but I don't know Clapper, on Instagram, on TikTok. I don't know. I think when I go live, then it goes away once I finish in 24 hours or so. So all I am asking you is, please repost. If you think that what I am saying is true, only if you think that what I'm saying is true and what I'm sharing with you is the honest truth, is the pain that my child and I go through, then share this. Because you don't know whose life you're affecting. You don't know whose life you can make better by sharing information that I am giving you. Whether you are black, whether you are white, whether you are Latina, whether you are Hispanic, share this information. And I want to tell you something else, because I found out that so many Spanish women are disproportionately also affected by endometriosis and by PCOS. I speak 7 languages, but I don't speak Spanish. But I made it my point, and you will see more and more videos that I am making in Spanish, because I was born in Czechoslovakia. And there's Slovakia, so I speak many languages, Slovak and Spanish, the pronunciation of the letters is the same. So I can read in Spanish fluently. I don't understand per se what I'm reading, but I can read in Spanish. And because I believe that it is so important to share this information, because after black women, it's Spanish women, these are disproportionately affected by PCOS and endometriosis, and they have no voice, and particularly in the rural areas, that I started now making videos in Spanish. No, they're not long like here that I talk for an hour, because I can't talk. But I make videos and tidbits, I get it written out, then I read it out, and I make videos now in Spanish for Spanish women. I am trying to share this information, to educate women and to tell women that it's not okay. It's not okay that you have that you are in menopause at age 42, and that you are gaining weight, and that you had no hair, you had white hair, and now you are getting thick black hair, and the doctor tells you it's fine. No, it's not fine. No, it's not fine. And so I am sharing information now, and I'm trying to bring it out in many ways, in many possible languages that I can. And so I am doing it in Spanish. So if you guys will hear me in videos that I speak Spanish, I do not speak Spanish. Spanish is not a language I speak, but I make it an effort to educate and to teach women who are disproportionately disadvantaged, because nobody really cares. Nobody really gives shit. I think that black women and Spanish women are disproportionately disadvantaged in America for whatever obvious reasons. And the reason that I tell you and I share with you and I ask you to repost this, and I tell you a story. This is just that I had a conversation. So there's a black young man that suffers from HS. HS is hidradenitis suppurativa. It's an extremely painful disease, and I don't even want to ruin you Friday night and tell you how painful and how debilitating it is. But HS disproportionately affects black men and black women, and it affects disproportionately people even more so that are overweight. And so it's a very bad disease. It's a very painful disease. It's a very debilitating disease, and it all stems from unwanted hair, and it starts with one ingrown hair. That also is genetics. That also is something that medicine doesn't know. And by the way, HS, the same as endometriosis, there's no cure. And the only cure that you have, if you have stage 1 HS, then you come to see me and you do laser hair removal. And if you're a black person, you come to see me because I specialize in black skin and I have special lasers. But if you have stage 3 HS, I cannot help you. I will not try to help you. I cannot help you because it is so far gone. The only thing that can help if you are in stage 3 of hidradenitis suppurativa is excision. Specialized doctor, specialized surgeon that will go in and excise. The abscess is not only the ingrown hair that's encapsulated, it's the whole thing. It burrows, it creates a tunnel under the skin. It's very painful. It's full of pus, full of toxins. Oh boy, it's so painful. And that has to be completely excised, cut out. So that's the only solution. But this young black man that comes to see me, so he has HS on his pubis and the inner thighs, and he was very overweight. So that didn't help, because the folds of your belly, if you have a fold of your belly, you will get HS under the folds, because the perspiration, the bacteria, the fat, and an ingrown hair is a perfect recipe for disaster. So it happens. And so I asked him today, I said, how, because it was the second time that he came to see me. And I said, how did you come to see me? And he said, Eva, if you believe it or not. I said, go ahead, I believe you. So he said that about 10 years ago, he was 16. And he said that he suffered, and he's from Atlanta, that he suffered from HS since he was 14. And on his pubis area, around his testicles, between the butt cheeks, in his groin, it's really painful, under his armpit. And he said that he would watch me when I was on my YouTube channel, and he said, I would watch you, and whenever you would come up, I would subscribe, and I was just listening. And he said, I was poor. I had no money. But I knew that one day, I will work, one day I will have the money, and if you are still alive, and if you do work, I will come to see you. And so he said he saved my telephone number because my telephone number is mine for over 30 years. I have the same telephone number. And now he's a man. He's an adult. He's working. And he called me in November, October. He called me and he said, you don't know who I am, but I know of you. And I have HS here and here, and I would like to come to see you. And so we made an appointment. And I think he came, the first time he came was November. He couldn't come in December, but he came today. And he arrived today, and I said, oh, did you put braces in your mouth? He said, no, Eva. He said, but I lost 30 pounds since November till today. I said, oh my God. He said, this is why you notice, because I lost so much weight in my face. I said, what made you lose the weight? And so, surprise, surprise, a young, intelligent man. He said he did research, and his background is Jamaican, but he was born in America. His father has diabetes. And he did research, and he said no matter what he did, he couldn't lose weight. And then he did research, and he found out that he has insulin resistance. And insulin resistance does not allow you to convert your food and your fat into energy. It just stores it as fat. So no matter what you eat, it will immediately be converted into fat, and you become fat, and you cannot lose weight. And it's hormonal. So it's insulin resistant, it's hormonal. And I said, okay, so did you go on metformin? He said, yes. And he said, without any diet, I lost 30 pounds since November. I'm eating healthy, but I lost 30 pounds, and I see that, the fold of the belly, the HS is getting a little better because there is less fat there. And I said, I'm so proud of you. It is so wonderful. And I was so proud because he's a young black man. He's maybe, I don't know, is he 27? He's very young. Well, to 70, he's a child. He's a newborn, right? So I'm 70. So to me, he's a child. And when he said to me, and then he did the research, and he said, Eva, I researched my sister, and we all suffer genetically from my father's side, so we all have insulin resistance. And he said, as soon as I went on metformin, and he's taking a natural supplement, he said the fat is just melting away because he no longer converts or blocks. The insulin resistance doesn't block the fat conversion into energy. So he's now burning the fat and using it as energy, which is the normal process of a human body. But I share this with you because he saw me, let's say, 10 years ago or 12 years ago, whenever that was. And he was a kid. He was 16, 15, something like it. Very poor. He had no money. But he said to himself, I will keep this woman's telephone number. And I will call this woman one day when I make money. And so he was very fortunate to keep my telephone number, because what happened in the process, and most of you are not aware of this because you don't know me, but I had a YouTube channel, and because exactly how I speak to you, and I educate you, and I educate black people, and I fight for black people, and I fight for Hispanic people, and I fight for people who really suffer from hormonal imbalances, really have a problem. And I fight. And so this was my calling. And I had a YouTube channel that YouTube channel was in existence for 12 years. There were 73 million people on that YouTube channel, because I spoke to black people, not only in America, but all over the world. And black people listen to me, dark people listen to me, Hispanic people listen to me, Indians listen to me. Because as you can see, I'm not shy. Nothing is off limits. I would talk about any topic, and I would just talk. As you can see, I can talk for a long time. I don't have a script. I talk from knowledge, from my brain, and from my heart. And because I was talking disproportionately, helping black women, black men, and Hispanic women and Hispanic men suffering from different conditions but very similar, My channel 3.5 years ago was eliminated by YouTube because I speak to black people, I speak to dark people, and there is a no-no. And so, as many people know, um, in the previous administration, even though they told you that, oh, they are doing everything for black people and black people, that's always bullshit. And so when I share information, I share knowledge, and I share education, that did not sit right with the previous administration. And so YouTube CEO, and Google CEO admitted 2.5 months ago when they went to lunch, a business lunch at the White House, that they were forced by the previous administration to shut down a lot of channels that did not align with the philosophy of the previous establishment. And so my channel was eliminated. I could never get back my channel. I asked, I hired lawyers. There were 73 million people that watched me. YouTube would never give me back my channel. This successively caused me, because I have elbows, I escaped communism, and nobody will shut me up. And you can shut me up, I will fall down, but then I will get up. In particular, when I know that I am right. In particular, when a cause that I have is just, is correct, is the right cause, then you will have to shoot me. I will never go down on my knees. I will stand up, and you want to get rid of me, shoot me here in the head, but I'm not going down on my knees. And so not the previous government, no communists, no leftists, nobody will shut me down, because I know what I'm talking about, and I know that people need help. So after that channel went cockeyed, I started a new channel. Why I share this with you is because that young man, he was 15 or 16, was smart and intelligent enough to know that he took my telephone number down. Because every time I would say, okay, call 305-864-3333 if you want to talk to me. And he took my telephone number down. And then he didn't see me because they took the channel down. He didn't know how to find me. But I have a distinct voice and I have a distinct accent. And then one day, which was about, I don't know, 5 months ago, I was on YouTube. I created a new YouTube channel 3 years ago. And I speak the same thing about black skin, about Indian skin, about Arab skin, about Mediterranean skin, about women, about problems. I don't make beautiful. I speak the truth. I speak what I can do, what I can suggest to you, how I can help you, how I can make your life better. That's my call in life. And so I created this new channel, and that new channel, of course, I have to walk on eggshells when I speak, because in the United States, when you speak about black skin on Google and on YouTube in particular, it's considered bad, and you have to be erased and you have to be eliminated. And so I can tell you categorically, that's just to be a fact, and I will put it out there, because at 70, I don't give a shit. I don't. If everybody cancels me out, it won't be my loss. It will be everybody else's loss, because I won't be able to share information with you. But as long as I live in a free country, and I hope I live in a free country, I will say my piece, and I will say what I know to be a fact, and why I fight for black people, why I fight for Hispanic people, why I fight for women that don't have a voice. And so my clinic in Miami Beach, which is in business for 40 years on the same address in Bay Harbor, was removed from Google Maps. It was removed, and it was like 5 months ago. And it was removed because majority of pictures that I post on my Google Maps is of black women, black men, Hispanic women. So it's darker pigmented skin. And I say, so if I address something, I say black woman with endometriosis, black woman with PCOS, black woman with Hashimoto. So every time I would say black woman, black man, black skin, that triggered something in the algorithm. And so when my listing on Miami after 40 years was taken down, I did some research and I paid some lawyers, and they found out that Google's engineer admitted that the algorithm of Google is biased, and that if you in Google mention Black disease in black people, that's a negative. And if you mention black skin, that's a negative too. So the algorithm, and I said they are full of shit, because the algorithm was written by human beings. Human beings put their own prejudice into it. So Google, YouTube knows that their algorithm is biased against anything that you put black skin or black disease, black woman, black man with HS, black. And so both, and what do I treat? I treat black skin, I treat dark skin, I treat HS, I treat hormonal imbalances, I treat ingrown hair, I treat abscesses, I treat acne. So I treat skin and I treat conditions and I speak about them. And I post pictures. I post videos. I don't post beautiful pictures. I don't post a maximum exposure of sexy pictures. I don't twerk my ass in front of you, and I don't show my boobs in your face. I show real pictures of real patients, of real human being, of real suffering, because that's what I do. And so the Bay Harbor Clinic was removed. My listing was removed. And then after I found out about this, and I saw the interview of the CEO of Google, who stated categorically in the White House that they know that hundreds of thousands of channels were removed because they were pressured by the Biden administration. Of course, my channel was never given back to me because the prejudice still existed. One thing is to say something, another thing is to correct it. The correction wasn't done. So when the Google listing in Bay Harbor was removed, I decided to write a letter to Google. And what do I have to lose? Again, I don't care. You took my 73 million people channel down. You removed, so remove it, okay. I won't hang myself. The loss will be of people who I try to help. The loss is not mine. The loss is everybody else that I'm trying to help. So I wrote a letter. And I'm sharing this with you because I want everybody to have elbows. And I want everybody to do what you have to do. And in a way, being born under a communist regime, escaping communism, was very good for me because I learned to fight for myself. I learned to fight, I learned to be a fighter, and I learned to fight for what I believe is right. And this is what I do my whole life. And this is what I teach everybody that's in my life. And this is what I teach my daughter. Never let anybody tell you, if you believe you're right, then you fight for what is right. And so I wrote a letter to Google, and I said exactly what I'm telling you here. And I said to them what they did with my YouTube channel. And I said to them, I'm giving you 14 days to answer me, because now I sent a registered letter with a return signature, to answer me why my listing on Google, that a clinic that I have for 40 years, was removed. I said the only reason it was removed because I treat black people, because I treat black skin, because I specialize in black skin, because I talk about black skin, because I talk about suffering of people that suffer from hormonal imbalances and HS. This is why you removed me. So day 13, I got a phone call, and by the voice, I knew it was a black guy, and he was a lawyer, but it was a young black guy. The Google let him call me. And he said, oh, I'm calling you from Google. I said, you have nothing to say to me. I said, Google wants to respond to my letter. I said, the only way Google can communicate to me is in writing. Goodbye. And I hung up the phone. Ladies and gentlemen, 24 hours later, my listing in Bay Harbor, in Miami Beach, was back up. Because I have elbows, because I challenged them, and because they saw this is a big-mouthed woman, and we took her channel down, and she's still here, and we can't get rid of her. She's like a pest. She's speaking. She's not letting go. We better put the channel up before she makes a stink. So fine. They put the listing in Bay Harbor up. That was 2 months ago. I am in Georgia. I am in my Noonan clinic in Georgia. I'm in Georgia for 9 years. I opened my Georgia Noonan clinic to help black women that live in the deep south and Hispanic women that suffer from PCOS, endometriosis, Cushing's disease, Hashimoto disease, insulin resistance, diabetes, a thyroid condition, all of it, and unwanted hair and discoloration. And because Black women and Hispanic women that live in the Deep South don't have the ability, don't have the money to go to Miami Beach because it's expensive. It's expensive to fly and you have to come every 5 weeks. And over the years, so many Black women would call and say, Miss Ava, I can't afford it. You're in Mississippi, Alabama, Tennessee, New Orleans, wherever. I can't afford to come, or the Carolinas, to come to see you. And then one day, those of you who came now, I was talking about my daughter having gone for her 19th surgery, of which 40 were done in Atlanta, and I had a weak spot for Atlanta because the surgeon in Atlanta couldn't change the outcome. My daughter could never have any children. My daughter had 18 surgeries, lost 70% of her organs, but he made her life better. Every time he operated on her, it was better for half a year, for a year. She was not in pain. So, and he's religious, and he's a very nice, he's a Christian man. He's very, very religious. But I trust him explicitly. So I had already affinity for Atlanta. And so I said, okay, God gave me this doctor. So, and he's helping my child. He cannot change the outcome, but he's helping my child. It is my calling. God may put me in this situation that I have one daughter, one child. My child suffered her whole life for 32 years. I suffered with her. But I think there's an old saying, translated into English, God doesn't give you more than you can handle. And so God gave me a child that suffered so much. And I think it was, God gave me, of course, it was my brain, it was my research that I found the doctor, but I think God has a hand in it. And so God gave me this doctor, and I was able to help my daughter, at least if it was only for half a year, for a year, to live without pain. That I believe that it was my calling backwards when Black women and Hispanic women would call me and say, Miss Ava, I can't afford to come to Miami, but there's nobody like you in Georgia. That I decided to make this decision 9 years ago, and to come to Georgia and to open a location in Georgia. And I did it. It was work of love, empathy on my part for all the women that don't have Ava as a mother, for all the women that don't have the knowledge, the experience that I have. And so I opened this clinic in Noonan. And because I have a very busy and very well-established clinic in Miami Beach for 40 years, I could have not just left. And because I do laser hair removal for black skin and for dark skin, and that requires expertise and it requires special equipment and special machines, I set everything up in Georgia. I opened the clinic, I set everything up, and I said, okay, how can I manage this? And the only way I can manage this is I come to Georgia every 5 weeks. I don't live in Georgia. I come every 5 weeks, and when I come to Georgia, I have women that come from Alabama, Mississippi, Tennessee, Tallahassee, North, South Carolina, up to Virginia. People drive. People drive to come to see me in Noonan, in Atlanta, in my clinic. So I make it possible for women to come to see me, to get laser hair removal, to get treatments. Whatever women need, whatever I can help them, they can drive, so they don't have to fly. It doesn't cost them that much money. And I can help them to give them back their self-esteem, to change their life back to what it's supposed to be, not what it is. So that's why I came to Georgia, and I opened the clinic in Georgia, is because it is work of love. And to prove how much work of love this is, I used to fly from Fort Lauderdale to Atlanta up to COVID. And when COVID happened, I have a commitment. So I didn't come to Georgia for 2 months. But then I had to come because people paid me and people are waiting for me. And this is an ongoing treatment. So I started to drive to Georgia. And I am a big animal lover. I'm a big animal lover, and I have rescue dogs. Dogs are my passion. And I have a lot of rescue dogs. And when I come to Atlanta, I go for a week. I go for 5 days. I need to have my dogs with me. I cannot put my daughter in charge, who also has her rescues. So I bought a car. I bought a big Yukon XL. I took the seats out. I only have one seat. I mean, two seats. There's one seat here, one seat here. But we took all the seats out. And I created a huge bed platform and foam. And I use since COVID, I travel with my dogs. I travel to Georgia. So I can make it. I come with the dogs. I have a house here. I come with the dogs. I treat patients. I treat my clients. I do what I have to do. And then we are driving back. And I'm driving here. I'm driving, come. Here's one baby that I have. And I'm driving every month, every 4.5 weeks, I drive to Atlanta and back. So it's 12 hours. And I drive with my dogs. And so normally it would be 10 hours, but it is 12 hours because I have to stop. So I stop 3-4 times because they need to go pee-pee, they need to go kaki. And I have dogs that weigh 90 pounds and I have dogs that weigh 5 pounds. He's a rescue. I have him for 2 years. He's very old and he has epilepsy, but that's my calling. And I love them very much and I take very good care of them. And yeah, he has a diaper because he pees everywhere. So we are sitting on the couch and I don't want him to pee, so he has a diaper. So that's the story of my life. And this is how I ended up in Georgia. And again, I will say, any woman out there that suffers from unwanted hair, that suffers from ingrown hair, that suffers from PCOS, that suffers from HS, hidradenitis suppurativa, that suffers from discoloration, whether you're black, whether you're white, whether you're Hispanic. It's not supposed to be like this. There is help. There is help. There are ways that you can treat it. You cannot get rid of HS. You cannot get rid of endometriosis. But there are ways that you can help it. There are ways that you can make it less. There are ways that you can control it. Go to my stent store. So wherever you are on social media, I think on my homepage somewhere or however it's called, I have a link. And there is a link to stent store. And the stent store there are some guides in the stent store that I put information that you can download. It's for free. Yeah, there are guides also that you have to, you can download, you can buy them, but they're guides that are for free. And you can download it and learn from it and get information from there. And if you have questions, you can also contact me. In there, I also posted a link, and this is for another time. But endometriosis, Cushing's disease, PCOS, insulin resistance, comes with another condition, and that's excessive weight gain. And my daughter gained over 100 pounds in the process of her life. And my daughter did every exercise in the world. Every gym she joined, everything that could have been done was done. And my daughter could never lose the weight, no matter what she did. And so, because she had insulin resistance too. But because she had so many other conditions, it was very hard to manage. And so eventually, my daughter decided a year ago to go on the GLPs. And I made other videos about this. And finally, there's many videos. And if you go to my YouTube channel, which is Eva Taub Skincare, there will be some videos that you will see where I am with my daughter, where we are talking about this. But I want to put this out there because you can get it for free on the Stan store that I have. And as she's losing weight, and she got this Ozempic face, and again, I did a lot of research, and I said, I don't want her beautiful face to become an Ozempic face and be, so I researched a lot, and then I created a list of supplements and minerals that every woman that goes on GLP 1, 2, 3, whatever you take, you should take the vitamins, the supplements that are going to help you. Now, I am not hacking one supplement because on purpose, because I'm not sponsored, I am not paid. I put a list of different companies, I just researched and put different lists, different companies for all the vitamins and minerals that every woman that goes on GLPs injections and wants to lose weight, please go to my stand store. It's free. You can download the list and then you can buy your own vitamins wherever you buy them. I just gave you the name, what vitamin you need, and what is the quantity, how many micrograms, what you should take. This is what my daughter is taking. So I put it in, and that's in my stand store, and it's free. You can download it for free. If you go to stand store, there is a section of the free vitamins again. I'm not sponsoring anybody. Nobody is sponsoring me, and therefore you will see different companies. So I on purpose went and bought different companies, so it should be very clear. I'm not sponsored by anybody. I'm not paid by anybody. I did this because I could see what was happening to my daughter, and I didn't want that to happen, and I don't want other women that to happen and other men. If you do it rapidly, you shouldn't do it rapidly. You have to take the appropriate vitamins and minerals and supplements so you can give your body and do it slower so you don't get this Ozempic look. So it's on stand store. Anybody that has any questions, guys, please by all means let me know. You can contact me, or if you want to book a consultation, if there are all the links there. Allow me just to look if there's anything that I'm supposed to answer. If there's any, let me just look if there's anything that I'm supposed to answer, because there's many people, and I will leave it out. I will leave it out on, so everybody can reach. There's like hundreds of people here, but allow me just. Oh, okay. Well, I didn't see who. Okay, you are right. Okay. Okay. All right. I don't think you did skincare in Miami. Did you do skincare? Yes, I do skincare in Miami. Okay. Someone needs. Okay. You work hard. Yes, I do work hard. But I have a reason why I work hard, because I want the world to be a better place, and I want the right information to come out. Okay. All right, guys. I don't think that I missed anything. And there are some questions. There are some questions that people have that I will answer privately. Okay. That would be it. Thank you so very much for staying with me, as always. As always, if the information was or is helpful to you, please share it. That's all I ask. Don't subscribe. I don't need you to subscribe. Just share my information. Repost this if you have a friend, if you know somebody, if you have a child, if you have a family member that suffers from PCOS, endometriosis, Cushing's disease, insulin resistance, anything. If you have any of this, please share it, because you don't know whom you can help with the information that I provided you today. Until next time, I wish everybody an amazing, amazing weekend. Thank you for spending the time with me. I really appreciate it. And I hope that tomorrow will be a better day. Thank you, guys. Ciao, Eva. Ciao, ciao. And okay, and here, okay, end.